Okay, now is the last content of this class. The joints of skull. First, you should know the skull. Between different bone, there is a suture. For example, here is the superior view of the skull. Here is the frontal bone. On two sides is parietal bone, frontal bone. On the back is occipital bone. Okay, and between the different bones, there is a suture. The suture is direct connection. They are very close. Okay. And this suture don't need to matter. Now let's see about another important joint. This one is temporal mandibular joint. This joint is formed by two bones. One is temporal bone. Another one is mandibular bone. Now let's see the composition of the joint. First, the head of mandibular. Here is the remors of the mandible. The posterior process here is hide. Here is the hide of mandible. Will form the hide of the joint. And what structure will form the fossa? One is mandibular fossa. You see here. Here is the mandibular fossa of the temporal bone. Another one will form another part of this fossa. This one. I'll change another color. Here. This one is articular tubercle. Articular tubercle will form another part of this fossa. So here is the head, here is the fossa. They will form these joints. Its composition. And what's the characteristics? First one. In this cavity, there is a disc. Articular disc, and this disc divided the cavity into upper portion and the lower portion. The second one is on the lateral side. You see the right temporal mandible joint. On the lateral side, there is the ligament, the lateral ligament from the zygomatic arch, okay, to the posterior border of mandible. There is the lateral ligament, and this ligament can strengthen this joint and prevent the joint move laterally. Now is about movement. The first, this joint can move upwards. Move upwards is elevation. Is close your mouth, elevation, and go downwards is depression. Open your mouth, depression. Okay. The second pair, protraction or retraction. Protraction means the mandible move forwards is protraction. Then move backwards, retraction. Okay. Please do try by this action. And the third pair is side to side. You know your mandible move laterally. To right side, left side, right side, side to side, okay? And if elevation, depression, left side to side, they will move together. For example, first elevation, then to left side, then depression, then to right side, then elevation again. And this circle movement we name it rotation. It's also one special type of rotation. And all these action, you should know, all these section must finished by your two temporal mandibular joints together. Only one side move can't do this action. So this must do together. Okay, it's about movement. This movement is very important. Help us to speak, help us to talk, help us to have the dinner. So it's very, very important. Okay, it's important concept of this class. You should master some important joints. First one is shoulder, second one elbow. The wrist only know the composition and the movement is enough. don't need mastered characters. And then it's hip, the knee, the ankle is like the wrist, only know the conversation and movement. And last one is temporal mandibular joints. And these 5 joints is important joints. Master the conversation, characteristics, and movement. Okay, is the content of this class. See you next time. I'm here.